The Swiss Clinical Trial Organization is a quite young, but very dynamic and agile organization. A lot has been achieved within the past 10 years of its existence. So, for example, an extensive network has been established, both on a national and international level. And during my time at Swissmedic, I already had the chance to be involved in some of the SCTO's activities, like, for example, in UPATI. I have to say that I always enjoyed the good working atmosphere and the trustful cooperation. And so I look very much forward to contributing to the team's activities now. Furthermore, as a trained pharmacist, clinical research and also the development of therapeutic products, this has always been of great interest to me. And so I'm curious to learn more about it. While working for Swissmedic and being responsible for the networking of the agency, I had the great chance to contribute to building up and further develop Swissmedic's cooperation with many different stakeholder groups, both nationally and internationally. So targeted stakeholder engagement, a customized communication, and trustful representation of the agency in various decision-making bodies, this has turned out to be of great value. So in my opinion, mutual respect, openness, reliability, this is essential in building up a cooperation that is based on trust and that lasts in the long run to achieve common goals. Trustworthiness actually ranks on top for me. And this turns out to be of advantage now in times we have to perform social distancing. I'm very much looking forward to further driving and implementing the strategic concept of engaging patients in the whole process of clinical research. Acting as an ambassador for the SCTO, further raising its visibility and representing the organization in committees and contributing to successful SCTO events, this is something I'm keen to support. Last but not least, I'm also looking very much forward to the cooperation with my new colleagues from the communications team. Together with them, I would like to further explore and develop SCTO's communication strategy. For a long time, patients have taken part in clinical research, but merely as trial subjects, meaning that research has been performed on them, but not together with them. Active patient involvement, however, means that the patient's perspective and special experience with the disease and therapy is heard and integrated into the whole research process. So going forward, patient involvement ideally starts prior to the start of a trial to consider the patient's view when identifying research priorities. In my opinion, it continues in the phase of trial design. It moves on to performance and management of the trial, includes data analysis and dissemination, finally evaluation, and very important, the communication of study results. The level of involvement might differ in the various phases on a case-by-case basis. But whenever possible, it aims at establishing a longer-term partnership and involves the patients in the decision-making process, thereby enabling a truly meaningful cooperation. In my opinion, the Swiss clinical research environment could benefit from a more holistic concept of how best to involve patients in a meaningful and sustainable way. In the end, clinical research should find evidence-based answers on patient-relevant questions. So to set academic clinical research priorities and to make best use of limited resources, we actually need the input from those that eventually take or get the product. I still have the impression that quite some clinical research is performed in silos, with the consequence that the results, the evidence that is generated is not shared with others. And thereby, this leads to wasting of precious resources. Those silos, in my opinion, need to be opened up and form a well-structured network to leverage the data we have. Most data generated still stems from randomized controlled trials. This is our gold standard in clinical research. Yet there is data generated in routine care, so-called real-world data. And this is getting more and more important and more within the focus of both regulators, health technology bodies, and also reimbursement agencies. So in my opinion, it is not one or the other, but it is both combined and merged, making best use of the new digital technologies we have and also innovative clinical trial designs. No, networking functions without magic if you perform it with the right state and the right spirit of mind. In my opinion, networking should always be an exchange, a meaningful interaction. This interaction requires openness and real interest in other people. This means listening to other people with genuine interest in their perspective and also trying to understand where they come from. Trying to understand does not necessarily mean that you need to be in agreement. Another important networking principle, in my view, is to avoid premature judgments of other people. Through judging, we easily separate because the other person feels attacked. And what happens is he puts the shields up and the conversation is blocked. Through understanding, however, we can connect. And this is actually what we are looking for when networking. It is this connection we want to have.